he's not going to ask you something. I was like, has he ever asked a question that's not about like money or budget or something that's like,
We try to keep them
they're very good policy. Usually you ask pretty good questions. I would say we're lucky that you're good at most of them. You could have fun.
It should be just a couple minutes.
Okay. I've long thought that that is like the best form of hazing for people for members of here would be to like just take some, you know, some obscure amendment vote, a street like 10 amendment vote, and then just ask, you know, have people 5 or 10 of us gather. Why do you vote no on the amendment to so and so? This is just to see if you're care. That's kind of actually having a mild, I won't say crisis of conscience, but I use budget processes. Crisis on Friday, one night, the last. And they're not necessarily meaning. I was going to say, in the past you typically have, and this year I said, I don't see the point it's been better than I basically won the roundup story on Wednesday. All three got through. Leave it. And I feel it's too weird because I feel like should be I'm actually more service by not wasting our readers' time. But I still feel vaguely. I want machismo.
We're not missing much outside, are we? Yeah.
Somebody's trying to knock this over.
I never eat Rhode Island is short. But I don't know how long.
Good afternoon, everyone. On Friday, as you know, some of us came together to talk about the Ryan Republican budget and the damage that it did to the prospects for our children and their education. We talked about the fact that it would cut Head Start. It's a debatable issue, but around 170,000 kids would be cut from Head Start. Children learning, parents earning. See what that does to families. Over 3 million children in disadvantaged areas, Title I schools, 3.5 million kids would see cuts in what came to their advantage. And then, of course, that we talked about Pell Grants, big cuts in Pell Grants and what it meant in terms of student loans as well. So from the earliest childhood education to higher education was very damaging to our children and their future. Today, we're here to talk about what the budget does to seniors, millionaires over Medicare, shipping jobs overseas, giving tax cuts to ship jobs overseas rather than, and making seniors pay more for prescription drugs. It's appalling. And I'm pleased to be joined by two of my colleagues who are part of our Seniors Task Force, Medicare and Social Security, Congresswoman Jan Schakowsky of Illinois and Congresswoman Doris Matsui of California. You'll hear some specifics about the budget and seniors from them, and then our wrap up for what it further does to seniors from our distinguished ranking member of the Budget Committee, Mr. Van Hollen. But once again, families get hit right at home. Friday, the damage to children and their education. Today, to their grandparents. Now I'm pleased to yield to Congresswoman Schakowsky.
Thank you, Madam Leader. I am Jan Schakowsky. Doris Matsui and I are the co-chairs of the Seniors Task Force of the Democratic Caucus. You know, the Ryan budget was announced on April Fool's Day, but to many of us, it's more like Groundhog Day, another Republican budget, and another attack on Medicare. Under this Ryan Republican budget, traditional Medicare premiums will soar by an average of 50%. The National Committee to Preserve Social Security and Medicare called it, quote, "The GOP Ryan budget is nothing short of an all-out declaration of war against millions of American families still struggling in our recovering economy." Many seniors have not regained income and assets lost after the Great Recession, and many of the long-term unemployed are older workers facing discrimination, and half of senior households live on $23,500 or less. That includes their Social Security and all of their income. If budgets are about values and priorities, then the Republicans have made it clear that current and future seniors simply don't rate. Once again, they're shifting costs onto the back of seniors who are already burdened with medical costs, paying 15% for their health care, 3 times more than non-seniors. Under the Republican budget, they will see that burden increase 11% upfront and then up to 56% in higher premiums over time. The Republicans go after seniors in 3 ways. First, the Ryan Republican budget increases cost share Medicare. While their budget gives millionaires an average of $200,000 tax cut, it increases premium costs to middle-class seniors. And as you will hear from my colleague, Doris Matsui, takes away cost savings achieved in the Affordable Care Act. Second, the Ryan Republican budget raises the age of eligibility for Medicare, making seniors wait longer for the benefits that they've earned. Third, and most important, the Ryan Republican budget goes after the very foundation of Medicare. It would end Medicare as we know it, turning it into a voucher program, making it harder for seniors to choose their own doctor, and ultimately killing traditional Medicare. Because those vouchers would pay less and less over time, more and more of the costs would be paid by seniors. Younger and healthier retirees then would probably go into private plans, driving up the premiums for traditional Medicare. Privatizing Medicare means that insurance companies and not seniors would be in control of choosing doctors and setting the rates and setting the rules. Republicans have been trying to end Medicare guaranteed benefits for decades, and this budget continues Newt Gingrich's call for it to wither on the vine. I'm proud that the Democratic budget that will be offered this week rejects the Republican proposals. Our budget will reduce health care costs, not shift them to the seniors. Our budget will protect Medicare, not turn it into a voucher program. Our budget will allow seniors to choose their own doctors, not let private insurance companies make the selection. And our budget believes that protecting seniors, not millionaires and billionaires, should be the top priority. Thank you.
Thank you, Jan. It's a pleasure to be with her as co-chair. The Ryan budget, I look upon it as heartless, irresponsible, and unacceptable. When I think about a budget, I think about a moral document of our priorities. And this document shows a marked disregard for our seniors. Let's unpack the word seniors. Seniors are people. They're our mothers and our fathers, our grandmothers, our grandfathers. They're the ones who raised us, who nurtured us, who fed us, who educated us. And I believe that it is important for us as a covenant of the generations that we now look after them. In 2010, Congress passed the Affordable Care Act. And I had talked with many seniors during that process and afterwards. And they were so happy for the new protections that the Affordable Care Act brought to them. I hear from them all the time. For instance, William came up to me just recently and said, Congresswoman, I got a wellness visit. First time, and I'm sure thankful for that. Marie, who is 67 years old, I think you know people like Marie, who, because of her own budget, didn't want to go to the doctor unless she was really very, very sick. Well, because of the Affordable Care Act, she was actually able to get preventive care. And so she went and got her first mammogram, which showed that she was in the early stages of breast cancer. But because it was early stages, she was able to get effective care. Now, let me tell you, that is so very important. We're also talking about seniors who have high prescription drug costs. And we call this area where there's a gap called the donut hole. Well, because of the fact that we're able to close the donut hole, many seniors now are able to afford more prescription drugs at a lesser cost. Let me just say this. With the Ryan budget that we have now, if we go forward with this, is that, let's say, wellness visits, gone. Preventive care for seniors, gone. And closing of the donut hole and saving for seniors, gone. This is wrong. We cannot allow this to happen. For instance, reopening the Medicare prescription donut hole would cost seniors $12,000 over 8 years, or on an annual basis, $1,500 in additional costs. What senior can possibly afford that because they're on fixed incomes? We have to think about this and realize the seniors are those that nurtured us, took care of us. It is up to us now to stand up for them. And I think it's something that all of America has to think about as you look at the Ryan budget. The Ryan budget is heartless, it is irresponsible, and it is unacceptable. It's my pleasure now to present Chris Van Hollen, ranking member of the budget chair, who is really always responsible.
Thank you. Well, I want to thank the co-chairs of our seniors task force, Congresswoman Matsui and Congresswoman Schakowsky, for their great work. To Leader Pelosi, thank you for bringing us all together and focusing on America's priorities. And as my colleagues have said, and as the American people know, budgets reflect the choices we make for our country. They show what we care about. They also show what we care less about. And at every juncture, the Republican budget chooses to protect special interest tax breaks at the expense of everybody else in the country. Last week, we talked about how they reduced the top tax rate for millionaires by 30% by also cutting important investments in our kids' education. And at the same time, they protect these tax breaks that ship American jobs overseas while they violate important commitments to our seniors. You've heard about the violation of the commitment to the Medicare guarantee. It would turn Medicare into a voucher program and dramatically increase the premiums for seniors in traditional Medicare. It reopens the prescription drug donut hole, adding thousands of dollars for seniors with high prescription drug costs. And it eliminates the current preventive care that is now comes without copays to encourage more seniors' access. It also delivers a body blow to seniors who also need support from Medicaid. The Medicaid budget is cut by a full 20% by the end of the budget window. In fact, it's 25% at the end of the budget window. That's $730 billion plus cut to Medicaid, a program that is already stretched thin. And it's important that people remember that fully two-thirds of Medicaid expenditures go to seniors and individuals with disabilities. So that dramatic cut will hurt seniors in nursing homes, hurt seniors in other fragile settings, and 1 out of 5 seniors on Medicare also relies on Medicaid to help pay the bills. So across the board, this Republican budget chooses to protect the very powerful, the very privileged, and the very wealthy at the expense of our commitment to seniors. And that is a choice that the country would not make, we don't believe, and certainly we don't make that choice in the budget that we'll bring to the floor.
Thank you, my colleagues, not only for your presentation today, but for your leadership on these issues. And I think it's important to note as I listen to them, of course, as Congresswoman Matsui says, and as Mr. Van Hollen always says, the budget should be a statement of our values about what is important to us. We all like to present ourselves as family-friendly in all of this, and as they were speaking, I was thinking that in the course of the budget talks, I've had conversations with large groups of high school students, college students, and the rest, because their names are always taken, and sometimes in vain, to say, well, we cannot heap mountains of debt onto future generations. And that is exactly what the Ryan budget will continue to do if we do not invest in the future. As I said the other day, nothing brings more money to the Treasury than the investment in the education of the American people, from earliest childhood through lifetime learning. And these young people, when they would come to our meetings and the rest, as they come to our meetings, they would say, these are the things we'd like to see in a budget. We want to see a strong public education. We want to have libraries that we can go to, things like that. But they brought up and said it's really important for our families to know that our grandparents are taken care of under Medicare. So the young people are advocates for Medicare because they know what it means to the economic security of families. And on the subject of Medicaid, many, many young women are out there campaigning to have states expand their Medicaid coverage under the Affordable Care Act because they know what it means to their families. So this saving of Medicare and Medicaid is an intergenerational initiative because families know that for families to be intact, we not only have to educate our children, we don't want our seniors. Imagine being a grandparent and saying to children, you're going to have fewer opportunities because I have greater needs, because somebody's ideological view in Washington that we should voucherize Medicare and make seniors pay more while we give tax breaks to millionaires. Any questions?
Leader Pelosi, is the Ryan budget so bad that it will help you regain the House?
we're not thinking politically on this. We just want to have a debate on the issues because this is about who we are as a country. If we're going to be strong as a country, we've got to mitigate for any challenges to the well-being of America's families. And again, we want to be number one, and you can't be number one without education and the rest, but you also, again, have to lessen the risk that families would take to be entrepreneurial. But I'm going to yield to our distinguished ranking member on that subject. Again, we don't see it as political.
I think this is, this is the debate the country should have. I mean, this is about who we are as a country, what choices we'll make as Americans, and we're looking forward to a healthy debate. We think if you look at the Republican budget, it's totally out of touch with the priorities and values of the country. It may appeal to a very narrow constituency within the country, but it's out of touch with, most of the country. I don't think most of the country would make the choices they make. I don't think the country would choose to protect special interest tax breaks at the expense of our kids' education and our commitments to seniors. So look, we welcome the debate. I do think it's important that people in the country know what Republicans in Congress would do if they had the power to implement their will, right? I mean, this is a clear roadmap of what Republicans in Congress would do if they had the power to do it, and therefore everybody should take this process seriously.
Mr. Van, a question for probably Mr. Van Hollen. Just you mentioned the GOP plan being a roadmap. That sounds, a cynic might think that these plans are basically just sort of setting the framework for 2016 and the appropriations process after that. Where does your budget differ from the president's budget in those out years, FY16 and on? I'm
going to talk about our budget tomorrow. I'm happy to sit down and go over the details. Right now we're focused on how the Republican budget impacts seniors. I can tell you with respect to seniors, we do not end the Medicare guarantee. We do not turn Medicare into a voucher as the Republican plan does. We preserve the closure of the donut hole. In other words, we make sure that seniors don't fall into the donut hole. The Republican budget, of course, reopens the donut hole, and seniors will see $1,200 a year average increase in prices. We don't reinstate co-pays for preventive care services, and we don't decimate Medicaid, which will leave so many seniors vulnerable to cuts. So I can tell you with respect to all the issues we're dealing with on seniors, as my colleagues have said, our budget will support those commitments while the Republican budget undermines those commitments at the same time that they provide all these special privileges to the special interest and most wealthy.
How will you reduce the exploding costs of Medicare?
Well, let me just say that we build on the approach of the Affordable Care Act, which has contributed to significant reductions in per capita healthcare costs. As you know, the Congressional Budget Office actually projects that we've saved $1 trillion since the Affordable Care Act was introduced. So we build on that model, but I'll talk more about all that.
And there's very exciting news about how the costs are even going down further than we had not anticipated. We had hoped for, but it's coming to fruition. Yes, sir.
Tomorrow, the president is expected to sign executive orders related to federal to equal pay for women and federal workers.
Yes.
Can I get your response to critics of bills like the Paycheck Fairness Act who say that it cuts flexibility in the workplace for working moms and ends merit pay that rewards good work?
Well, let's just put it this way. That somebody is criticizing equal pay for equal work for women in the workplace. Do they have a mother? Do they have a daughter? Do they have a sister? Do they know any women? They want to justify a woman working side by side with a colleague who has equal qualifications, education, experience, etc., and that person should make more money than the woman. And in fact, this week we will be coming together again on the issue of women and the budget. But this week marks the time when women will have worked for free for the first 3 months of the year compared to her counterpart with the same qualifications. If women make around 77% of what, 77 cents on the dollar for what a man makes, same qualification, same job, then January, February, March, a little bit of April, a woman is working for free. I'll take that up with anybody and what they want to say about this. It's not about flexibility. It's about total unfairness that has to become, again, and some might call it a double standard. Thank you all. Thank you. We have to go. But, no, you're not up to date. They made an announcement already today. You might want to go see what.
Can I ask you about Breitbart, California, and they took your image?